Good day. I'm Guy Dankos, and I'd like to welcome to our table today Dr. Shannon McDonald. Dr. McDonald is with the First Nation Health Authority from British Columbia, and she fills the position of Acting Deputy Chief Medical Officer. Welcome, Doctor.
Thank you very much.
Shannon, we're producing this interview in the context of a future Aboriginal Health Research Center. So, what role does Aboriginal women play in family and community health?
As a mother and grandmother, I take great honor in being a nurturer and a caregiver. But beyond that, I think women set the tone for how life and community goes. And there's a saying from a nation in the United States that says, no nation is defeated until the hearts of the women are on the ground. And we see a real resurgence in the power of women in communities to impact health service delivery and wellness at the community level. So I think we play an essential role.
Are there research gaps with respect to Aboriginal women's health?
Oh, absolutely. The biggest challenge that we have is identifying the women from our nations, First Nations, Métis, and Inuit, within provincial health systems and federal government data sources. Reliable identifiers are hard to find. Funding is often incremental. There's a little bit here, a little bit there, but it is very challenging to look at how health status has changed over time and how we compare among ourselves within our nations and against other populations in the country. So it's a big challenge.
What are the cause and effect of those gaps?
Well, I think the causes have been a lack of focus specifically on First Nations and Aboriginal women. The standard of research over time has been very deficit focused, looking at illness. The focus we're hoping to turn this to is more of a strengths-based and wellness focus. Those are things that have not been looked at over time, but in the spirit of reconciliation and recognizing the resilience of our communities, we're really hoping that more of that focus and attention will be paid, more reliable funding will be available, and we will be able to truly know how we're doing in terms of our health and wellness and community so that we can focus programming to support people in their wellness journeys.
So how would Aboriginal women's increased involvement in health research impact healthcare programs and policies?
I get a little conflicted about this message because I think on one hand, as an Indigenous woman, I'm looking and saying, well, nothing about us without us. It's absolutely essential that we're part of the analysis of any data that refers to us as individuals, as families, and as communities, and as nations. On the other hand, having worked in federal and provincial governments and now with the First Nations Health Authority, I see what some of the challenges are over time. So this is going to be a matter of changing minds and hearts with funders and with partners that we have so that we can walk together. Once we have a better understanding of not just what the numbers are, but what the numbers mean in terms of where we are, what we need, and how we measure change over time so that we can adjust. We know what's working, we know what's not working. And I think many people have said over time, well, you know, those folks in Ottawa or here, those folks in Victoria talk about First Nations from their viewpoint and their frame of reference, their worldview. And I think it's very important for us to bring the Indigenous worldview and especially Indigenous women, bring the worldview that we have to how we're going to plan, evaluate, and report on the health of Aboriginal women.
So if we close some of these gaps, would it translate into having having Aboriginal women that would be better, or that would be healthier?
Well, that's certainly the hope. At the moment, the First Nations Health Authority, in partnership with the provincial health officer from BC, are working on a Aboriginal women's health report that's hopefully going to be ready for release in 2017. And we have gone through many of the challenges that I've already mentioned in terms of accessing information and looking at not only the health status of women now, but the things that impact our health. So some of the social determinants of health, and some of those determinants that are specific to Indigenous populations, the role of women in community, the challenges to patriarchy that came with colonization, and some of the other pieces. So the hope is in identifying what some of the issues are, in targeting programs to change, to overcome some of the barriers, that will be able to improve the health status of women, and then by extension, the health status of their families and communities.
So from what you just said, I'd like to stress a little bit on the improving women's health as an impact on family.
Absolutely. I think the stronger we are as individual women, the ability to have power over our own health journey, to be able to be knowledgeable in terms of health literacy, it helps us make choices for ourselves, and in turn make choices around things like nutrition, around things like education, around things like opportunities and safe, reliable childcare, and some of the things that women need to be able to succeed in their lives, both at home and outside of the home. Those are all part of the journey to wellness that is mental, it's physical, it's environmental, and it's spiritual. In having that control and having the needs to attain those things be recognized.
So what does reconciliation look like when it comes to women's health?
I have a hard time being very deficit focused. I really work very hard not to do that, to think in terms of strength and resiliency. But the systemic barriers that women in Indigenous communities have faced over time have been significant. And we talked about the patriarchy. We talked about interpersonal violence. We talked about the family impact, for example, of residential schools on parenting and on partnering and on family life. Those are all things that have impacted the wellness. And we need help. We need supports. We need true partners in healing, not only at individual levels, but at those family, community, and nation levels, to be able to move forward together.
How do we close those gaps? How does that disparity end up closing those gaps? How can we do it?
One step at a time. In BC, we worked very hard to have a tripartite arrangement with the federal government and with the provincial government to work in partnership with specific goals around changing the health trajectory of First Nations and Aboriginal people in the province. It allows us to truly partner around things like cultural safety and humility, around reconciliation, around meeting people on a nation-to-nation basis to plan a way to move forward together. We have declarations of commitments from our regional health authorities and other partners about how we're going to work together. And it's been several years in that process. The First Nations Health Authority, the only one in Canada, has now existed since 2013. We're very proud of that. And we're able to work not only in partnership with our nations. One of our strong directives is that everything we do will be community-driven and nation-based, listening to the voices of the community, the families, the individuals, on how we work with our partners. This afternoon, for example, I'm going to one of the communities to meet with a family who have had what they believe to be a culturally unsafe experience with the system. And we have an opportunity to sit together with our partners to identify that situation and to try to rectify it. And more importantly, to make sure it doesn't happen again. And the partnerships and the trust relationships that we've built have allowed that to happen. And that's what reconciliation is all about.
So, talking of community-driven, would we be better served if the research, instead of being top-down, would be community-driven?
Absolutely. The work that we've done in terms of our planning for the Aboriginal Women's Health Report, the goals for that report, the impetus for that report has really come from our women, from our communities. We have regular gatherings, regional caucuses with communities, and a larger provincial caucus on a regular basis to hear those voices, to talk about what the priorities are. And we can target our research and our data analysis around those priorities so that we can affect change in terms of program and service delivery and supports for communities to make the changes they need.
What could be done to create more meaningful research on Aboriginal women's health?
I think one of the things that we really need to do better all the time, we're learning, is around how we engage with individuals and communities to really hear their voices and to include their voices. And as I said earlier, the concept of nothing about us without us, making sure that the analysis that's done on data that's collected is meaningful, that people aren't making assumptions about what the meaning of that data is. And being able to, there's a statement within some of the work that we do that around cultural safety that the question was asked, how will we know when we've achieved it? And the answer to that is we will know when the communities tell us we've done it. So it really is a matter of listening and learning, understanding, the traditional knowledge that supports the ways of families and communities, and finding a way to be inclusive of that. One of the phrases that's used to describe our work sometimes is two-eyed seeing, to be able to do research that's considered valid by external folks, the folks in government, our funders, universities, and others, but in the same way has very powerful delivery within the communities, that they see themselves and hear themselves and can participate in the action that results from the research that happens.
And I suppose some of the communities could provide some people to help with that research.
Absolutely. I was very lucky in my training at the University of Manitoba. The Centre for Aboriginal Health Research supported me in my learning and was a partnership between the Assembly of Manitoba Chiefs and the University of Manitoba. We do some work in partnership with 3 of the universities in BC, 4 actually of the universities in BC, so that individuals from our communities are able to get the educational credentials and participate fully in research as we move forward. And hopefully over time, we'll be able to create a strength of individuals who can do that work nationally.
On these words of wisdom, this is all the time that we have, unfortunately, and I would like to thank you. And today I was with Dr. Shannon McDonald from the First Nation Health Authority in British Columbia. Thank you.
Thank you very much. It was a pleasure.